So my name is Irene Piryatinsky. I'm a licensed clinical neuropsychologist. Really, there's not much more to say in terms of me, but mostly about what I do. I'm very passionate about my work as a clinical psychologist and a neuropsychologist. What what the training that I've received has allowed me to be able to see a person within a spectrum. So I've started out as getting my training in clinical psychology, and then very quickly I've learned that neuropsychology is becoming my passion. I started out as one of my first practicums was at the Shattuck Hospital, and that unique opportunity of working within inpatient setting with patients who have HIV, who have TB, and working in the prison side of the hospital really allowed me to get a very good understanding of what neuropathology would look like, and allowed me to see individuals who were having very significant cognitive impairments that had significant intellectual disabilities. And so I've developed appreciation for neurocognitive disorders and started to develop appreciation of what possibly these individuals would look like when they didn't have their illness. And so over the years, I've gotten a chance to see kiddos and babies for testing, and I've got to work with imaging research. And by the time I was ready for my internship, I was lucky enough to get into the VA. And so at the Bedford VA, which was an American Psychological Association accredited clinical psychology and neuropsychology internship, I learned to provide state-of-the-art clinical evaluations to veterans. And those veterans who have neurocognitive disorders, those veterans who've had acquired neurocognitive difficulties. And I received rigorous and what at the time was most up-to-date treatments for veterans with neurocognitive disorders. And I was able to get very solid experience on how to help families.
That's great. So we're here obviously connected to Brighton Marine. How did you get connected to the folks at Brighton Marine? And what's that work like?
So the work is extremely unique, and every day I'm thankful for being here. I feel like this became like a second home to me. I feel like I spend more time here than I do at home at this point, which I absolutely love and appreciate. The work here is quite unique. In a way, Brighton Marine has always allowed me to do what I love, seeing patients for testing, for evaluations, for psychotherapy. And it also gave me a chance to get back to my love for veterans and to look at every single patient that comes in that has a history of being in the military or still on active duty, and to add that unique component to the work that we're doing with them. Now, I just want to say that one of the things that the veterans are coming in with similar issues that anyone who is not a veteran or not an active military person would come in. And you could see, I could see a veteran who had a stroke. I could see a veteran who has Parkinson's disease. I could see a veteran who has Alzheimer's disease, traumatic brain injury, learning disability. Having a status as a veteran or having a status of being military, active military duty allows me to take a step back and say, well, what else is going on with this family? What else is going on with this patient? What else could be contributing to the difficulties they're having? So we end up taking a very multimodal approach with our patients, which is why I kind of love the program that we've developed here, where in addition to addressing stroke symptoms or Parkinson's disease or Alzheimer's disease or learning disability, we could also say, well, how do these disorders impact the family? How does it impact the children? How does it impact the spouse? How does it impact grandparents? How does it impact friends? So we're able to not only conduct a comprehensive diagnostic assessment here on campus, but we can also provide individual psychotherapy. We can provide group work. And obviously, the fact that we now have a building here that is fitted and that is there for veterans makes it so much easier for us to tailor the type of services or the type of treatment that we can offer.
That's great. So it's clear the impact you are making directly with veterans and your passion for, which is fantastic. So talk a little bit about the family scenario and the impact that you have had with working with families.
So, oftentimes a patient doesn't just come in alone. They come in because there's a family member who's concerned about them. There is a daughter or son who's been talking on the phone with their dad or mom and saying, hey, something just doesn't seem right. So it always begins with getting family involved. And we always say, try not to come alone. try to come with family members so we can hear their concerns. It helps in several ways. It helps us to hear a bigger picture. And sometimes for a veteran, especially, or active military duty folks, it's hard to come and be honest or upfront about the difficulties they're having. There is a sense of wanting to make sure that nothing is wrong, wanting to be a caretaker, wanting to kind of be able to handle it. So when depression sets in, or if my patient had a stroke and now they're struggling with those difficulties, the response is usually, I can take care of it. So it's family members often are the ones who are starting to notice something is amiss. Something doesn't seem right. The dad is angrier than he used to be, or mom is less attentive to financial management, or she's leaving that stove on. So hearing from family members in a non-confrontational way of what is it that they've been experiencing. Sometimes it's the first time that our patients, that our veterans are hearing from their family members. Sometimes it's the first time that they're hearing how overwhelming caretaking has been. And so it helps me get a perspective of what the family is experiencing. And immediately my wheels are turning and kind of saying, well, what kind of help can we provide to the spouse? What kind of help the children need to be providing or helping with? And that gives us a bit of a chance to think ahead. I feel like there are times where I'm thinking just step and a half ahead of the family, kind of thinking, well, what's going to be the plan? Do we need to start thinking about health proxy? Do we need to start thinking about power of attorney? Do we need to get kids involved? Do we need to get a spouse into support group? Do we need to connect them with a neurologist? So it feels to me very much that there's very little we can do when we only work with one person. So a family unit gives me a chance to really address the whole system.
That's great.
And it feels preventative.
Sure. To your point, it also is more proactive as well, right? Because you're trying to get ahead of some of the issues and build those plans out. I know when I work with Brighton Irene, housing is a big thing, and affordable housing is important. Talk to me about, obviously the veteran housing on campus, and, what would you like those new residents to know about, particularly around your work and your availability to help them out?
Yeah, so what I want them to know is we are here from morning till night. I want them to know that even if they're not sure how to use us, we can always have a conversation with them. We can always listen and hear what are the concerns. Having housing is wonderful. It's a very stable way of starting. The next question is, what happens then? So there's so many useful services on campus. I'm just one speck of that. And there absolutely time when you just don't know how to use a psychologist. You don't know how to use a neuropsychologist. Neuropsychology is intimidating. There's no one just comes into my office and says, hey, Irene, test me. This is intimidating. This is time consuming. So I want them to know that if they're having moments of sadness that have been prolonged, if they are having cognitive difficulties, just don't seem right, if they have a strong family history of neurological or neurocognitive disorders, if they've had more than few hits to the head, and now that they've settled, they had a little bit more time, and now they're saying something is not right, if they're studying for that exam that they've been planning to take for a very long time, advancement exam of some sort, and they just can't pass it. It doesn't matter if you're 30, if you're 40, if you're 60 and you're studying for the exam. If you're struggling, talk to us. We can possibly help with accommodations. We could possibly help reduce anxiety and depression. We could possibly get good cognitive and psychological baseline if there's that family history of neurodegenerative disease. So we could be utilized in a lot of different ways, and being on campus is super helpful because they can call and schedule an appointment. They could send an email. They could send a text message. There are various ways of getting in touch with us. That's
great. And the fact that you're there on campus and so accessible is really a big value add for those veterans. And another line of sort of questioning that I wanted to bring up was, I've heard about training veterans to treat veterans, which I find to be a phenomenal thing. Speak to that a little bit in your work in that area. Yeah, no, I am super excited about this, and I feel so honored
and passionate about having a chance to train veterans. I will be honest, I've been training for a very long time. When William James reached out and we started talking about training veterans, I was a little intimidated. It's one thing to work with veterans. It's one thing to provide treatment for veterans. It's another thing to kind of start thinking, well, how do we train veterans? And so I started out very slowly. Last year, I took on my first veteran, and it's been humbling, very different experience. My student veterans come with their own experiences. They come with their own ways of approaching clinical work. And so it's been a bit of a dance of figuring out how I can provide the best supervision, the best clinical experience. We try our hardest to match my veteran students with my veterans patients, but I always say that every veteran student needs to learn how to work with any population, with anyone who walks through the door. So, I take my time with the veterans. Sometimes we take a little bit of time in terms of teaching them how to develop a rapport with the patients. Sometimes it's about them feeling so close to patients and feeling like they have to take care of them instead of working on these boundaries. Sometimes it's more delving into diagnostic work, and my student veterans have been so compassionate that and they feel like they've experienced what my patients have gone through. So there's this immediate connection that often happens with the student and with the veteran. It's beautiful to see, and I feel like every step of the way we're figuring out how to use it to the best of the student's ability and how it could help my patients as well. So it's been very interesting experience. I think the program has integrated nicely. This year we're taking on 2 new practicum students who are veterans, and I just find it to be a very successful program. And I think the unique part of it is that the neuropsychology aspect is something that we get to offer to these trainees as well.
Sure, especially those that have served and understand the intricacies of being a part of the service and going through training and combat and all that stuff. It's amazing that this exists, and the fact that you can pass along your expertise to those that have served. I think I'd love to kind of explore that further as we continue with these sessions. But really great work there. Anything else that people should know about the Veteran Network community, and particularly your clinic, that they should know? If there's 1 or 2 things they should take away as part of this conversation, what should they take away?
I love to talk about my work. So I do feel like neuropsychologists can be intimidating. The whole process can be intimidating. And I would love the community to know that as a neuropsychologist, I'm a psychologist first. My job is to first think about my patients and the experience that they're coming in with. And the brain is very complex, and the disorders within the brain and nervous system can alter behavior and cognitive function. And so my role as a neuropsychologist is to understand how brain structures and systems relate to behavior and thinking. My job is to determine what someone's strengths and weaknesses are and how we could best come up with a plan and treatment that could help someone. My job is to we call it kind of taking a brain for a test drive. We are typically looking at one's attention, thinking, memory, processing speed. And so I want my veterans to know that we are here for them, and we will listen to them, and we will hear their concerns and do what we can, not just to address one cognitive problem, but try to see them as a whole as much as possible. And I want to encourage everyone to, as much as possible, to think about getting family involved.